My name is Dr. Uche Agenmonmen. I'm an optometrist with Haven Opticals Limited, Lagos, Nigeria. The purpose of this video is for the evaluation of my clinical skills as one of the prerequisites for a fellowship with the Indian Academy of Optometry for low vision rehabilitation. Now, for the low vision rehabilitation, the process that I have taken for this examination is that prior to the patient coming in, a questionnaire was sent to this patient. So this is a low vision questionnaire that I sent to this patient. So the patient filled it out and sent it in. So it gives me information as to the visual function of this patient. So I'm going to be welcoming the patient in right now. This patient is a 41-year-old man, and he has macular degeneration, which was diagnosed like 2 years ago. So he's been using glasses, but he's also said that the glasses has not been helpful to him. So today we are going to go through a series of tests. Mr. Can you please come in? Thank you so much for the questionnaire that you filled. It has given me a lot of information about your vision. So I'm only just going to be asking you a few questions more. Okay. And if you have any question also, just feel free to ask.
Okay.
So from this questionnaire, is there any family history of macular degeneration? Does anybody have macular degeneration in the family?
No.
No.
No, nobody.
Okay. All right. So do you think your vision has deteriorated in the past 2-3 years, or do you think it is stable?
So I think it's stable now, but this started, like I told you, like 2 years ago.
Okay.
And I noticed the drop in vision, and over time, it's remained stable.
Okay. All right. So I'd like to know if there are any concerns that we haven't addressed in this questionnaire. Any question you'd like to ask me?
So it's pretty much what I want. So I want something that would help me to read and see my charts, my architectural charts, and also see things at far a bit better than what I can do on my glasses.
Okay. So what do you do for a living? What's your occupation?
So I'm a civil engineer.
Okay.
So we deal more with architectural charts and
Okay, so you like to be able to interpret your charts clearly.
Yes.
Okay. All right. So we'll go straight into the eye examination. So I've seen from your questionnaire that your concern is to be able to read tiny prints, and then you've also indicated in your questionnaire that you like to be able to drive.
Yes.
So these considerations are going to inform my decision for the kind of low vision device that I'll be prescribing for you today.
Okay.
But we're going to start with, first of all, finding out how well you see currently, before we determine the kind of device that will work for you. So I need you to look across the room for me. Take out your glasses.
Okay.
I know you said your glasses is not helping. It's not making any difference at all.
No, it's not helping.
All right, so keep your eye on the chart for me. I need you to hold this for me.
Okay.
What it is?
Yes.
Okay. I noticed that when you were reading the alphabet, you tilted your head a bit.
Yes.
Do you think you see better when you tilt your head a bit?
Yeah, so when looking straight up, I really don't see as well as when I try to look through the sides.
Okay. All right, very good then. All right, no, put it back there. And there are some holes here through which I want you to look at the chart and then tell me whether through this hole you're able to see any more alphabets apart from the ones on the first line. Are you able to see the next line? Not at all.
No.
All right, we'll flip your occluder to the other eye.
Okay.
Just to check how well your other eye sees as well. All right, so the chart we're using for this examination is called a Belinovi chart. I've placed this chart 4 meters from the patient to enable me to get the visual acuity, which is 660, which is also 1.0 logMAR. So we're now going to go over to do the near visual acuity. Please hold this for me. Sorry, just hold on. I need to find out. With your current prescription, put on your glasses. I need to check how well you see with your current glasses. So please keep your eye on the chart for me. Can you see any alphabets beyond the ones that you read before? So please hold this chart for me. This is a near point card. We're testing one eye at a time, as just like we did for the distance. Which of the paragraphs can you read? Okay, so for the distance magnification is a reciprocal of your visual acuity at distance. So your VA was 660. So now that, so for the magnification is reverse of it. So the magnification power is 10 diopters, which is 2.5 magnification, 2.5x.
Oh, okay.
Yes. So this patient's visual acuity at near is N48. And the target VA, what we're trying to achieve here is to get him to see N8. Yeah. So it's going to be since we're trying to get him to see N8 and the distance and the near VA is N48. So if you divide that, that's going to give us 6x. So the magnification that this patient will require, estimated magnification that this patient will require is 6x. All right, so having done that, we'll need to do the subjective and the objective refraction. So I'm going to be using my retinoscope for this patient. First, I'm trying. All right, so I need you to look straight. Just keep your eye on the chart for me. I need to put on the lights. All right. Mr. King, I need you to look across the room. Just keep your eye on the chart for me.
Okay.
I need you to tell me, with these lenses that I'm placing in front of your eyes, tell me whether there's any improvement with these lenses.
Okay, this
Patient has hyperopic astigmatism from the objective and subjective refraction that was just done. But like we can see, his vision is not improved in any way at all with the lenses. So I'm going to go ahead to do his examination, the fundus, using a fundus camera. I need to look at the back of the eye because he only just told me that he has macular degeneration. I want to be sure whether it's just macular degeneration we have to deal with or there are other conditions that would prevent him from having a good outcome with using a low vision device. So, okay. So I need to keep your eyes in there and look at, there are some green lights in there. Keep your eye on those green lights. I'm taking photographs of the back of your eye. Okay. All right, you can sit back. I'm done with the photographs. I just want to take a look at your eye generally and see. All right, so I would like to do what is called a confrontation visual field test. So what this test does for me is that it tells me how well you see to the periphery. So it gives me information about the quality of your vision. Because you see, tendency is that, okay, I can see straight ahead, but something may be happening on the sides that we are not aware of. Okay. So that's what I'm going to be doing now. So I need you to cover your right eye for me with your hands. Yes. Now keep your eye on my nose. Look at my nose. So I'm going to be showing you my fingers from different directions. I need you to tell me how many fingers I'm showing to you. All right, but don't look at my fingers. Keep your eyes at the tip of my nose. How many fingers can you see here?
I see two.
Two. Okay. All right, so I'm going to be checking your what's called it's called a near visual field. So it just tells me, whether you have anything like a scotoma. Scotomas are areas of missing vision. So that's what this test is all about, and it helps to inform my decision on the kind of low vision device that will work very well for you. So I need you to hold this, and then you have your glasses on. More light.
I think over here, where it looks like it's like they are not there. They look missing here.
Okay.
They're all good
They
here.
are good here.
Yes.
Okay, excellent. All right. So that gives me some information here. So I'd like to check your color vision, and I'm going to be using what is called an Ishihara test plates. So
Okay.
I need you to look at them and then tell me, if you're able to identify the colors appropriately, because the condition that you've come in with, macular degeneration, cones are involved, in the retina. So we'll just see how it goes. We'll see if there's any damage there or whether you're seeing very well. Please hold this for me.
Okay.
Not too close, like 1 meter away from you. All right. So
Okay.
what's this?
That's 12.
12. Very good.
Yes.
How about this? Okay, all right. So obviously you have color vision difference, which is to be expected because your macula has been affected, unfortunately. So we're going to do what's called a contrast sensitivity test. So what that helps, to inform me is the quality of your vision. Because every test that I've been doing here today is in black and white. And that's not real life situation. Real life is not black and white. So I want to know how you're going to be able to function normally outside of this test room. So I need to look at this for me. I'm working at a 1 meter distance.
Yeah.
So I need you to read for me from the top as much as you can. Okay, thank you.
S.
Okay, so what this tells me is that your contrast sensitivity is actually low, which means that you're going to be needing higher magnification and also more light to be able to do your tasks. So trying to determine the kind of low vision device that would help you to do your tasks like driving and also your chat.
Okay.
Just from the test that we've done so far, the magnification that I require for distance is 2.5x. So I've picked devices that are in that range so that we can look at it and then see which one works for you. Low vision is like you're working with a toolbox. So we're trying to see what works best depending on what your activities of daily living are. For example, you're an engineer, so you are literate. So I imagine that you're going to want things that are really smart, devices that will help you to see well. All right, so I'm going to start by, this is a monocular telescope, a clip-on monocular telescope. So I need you to put on your glasses. So I'm going to try and focus this. If you watch me, I'm focusing this. So by focusing, what I mean is you look through it and then you're going to turn this knob to see what position helps you to see better. So keep your eye on the chart for me now. Okay, so you prefer the second one. All right, yeah. So let me introduce another kind of telescope to you. This one is a clip-on telescope. Put on your glasses. Let me show you how this works. So you can tell me which one you're more comfortable with. The other option is what we call biotic telescopes.
Okay.
I need to take out your glasses. So the way this works is it's a bioptic telescope. So we can fit in your prescription here.
Okay.
And then when you want to see something that is far, you just chin down. So these ones actually can help you to drive. So let me show you how this works. So this is I need you to like move close to it until you are able to see. Just find a comfortable distance that helps you to. The other option is this. This is a handheld magnifier. So this one you have to hold it. Hold this for me. And then keep it here on top of this. Then take it up a bit. Move close until it's bold and clear for you to see. Then another device also that I think will work very well for you is a video magnifier, which can help you to, you can charge it and it will work for you for like 4 to 6 hours of continuous reading. So as you're reading, you're sliding it along the material that you're reading. All right, so I'll leave you to make your decisions now on which of the devices that you'll be going for, whether it is the digital one or the handheld or the stand magnifiers.